the world's a stage, and all the men and women merely players. Greetings, everyone. My name is Denise Wilson-Bate, lovingly Mama D, and I am the therapy and theater specialist at Lottie Wellness Group. If your preteen or teen has had experiences where you believe they could benefit from therapy, but maybe they're a little resistant to the idea, stay tuned because I may have that perfect solution for you and your child. First, let's talk about reasons why your child could potentially benefit from the mentoring or therapeutic program here in general. At this stage, the youth are experiencing things such as anxiety and depression, various traumas, behavioral and academic concerns, just to name a few. In fact, let me take you on a quick journey back to your preteen and teenage years. I'm pretty sure quick glimpses flashed in your mind about all the things you may have experienced, some good and some you prayed no one would ever find out about. I'm willing to bet that those adverse childhood experiences have shaped how you handle life circumstances now. So let's think about the chaotic world that we live in today. There is so much going on, and it is directly affecting our children. For example, many teenagers today are going through a socially awkward phase as a direct result of the pandemic. They want to belong or feel included in something, but have no idea where to start. Another example could be a teen who may experience digital withdrawal without their video game, tablet, or phone. If your child has experienced this, a direct result may manifest as anger or disrespect. I call this a teen tantrum. Those were just a few examples, but let's talk about solutions. As a clinician, I wholeheartedly support therapy at this age, even if no adverse symptoms are present. Therapy aims to help maintain the balance we all need. I'm sure you have heard the old saying that it takes a village, right? Well, therapy via mentorship is a component of that village. Studies show that adolescents thrive more when they have a positive mentor or a group to interact with versus those who have none. Traditional talk therapy may be beneficial for some, but for those who are easily distracted or just uncomfortable sitting one-on-one for an hour while being mandated to share their thoughts with a total stranger, an alternative approach may be beneficial. An approach that I call therapy and theater. I have been using therapy and theater for over 20 years. I have worked with adolescents in both the private and public sectors. Some of the success stories include, but are not limited to, overcoming the desire to self-harm, stopping substance abuse, showing an increase of respect for self and the family, showing a greater level of responsibility, and an overall change in behavioral and academic performance. Theater and therapy works because it is expressive and it allows the participant to receive therapy without feeling like they are. It gives them a circle of friends where they feel heard, seen, and most of all, included. They are not bound during sessions. In fact, they are encouraged to get out whatever they're feeling in a judgment-free, safe space. The goal would be to allow the adolescent an opportunity to purge whatever they desire. Then we identify any problematic thoughts or behavior. Once identified, we will role play the scenarios to show both the negative and positive outcomes with the hope of reframing those adverse thoughts into productive solutions that the mentee can use to change how they handle various situations outside of therapy. Oh, there's so much more I can say about this program. However, I want to give you the opportunity to schedule an appointment with me to discuss the program further. Or you can simply jump right in and register your child in the PRP mentorship program. Once registered, search for me to schedule your child's first TNT group session. I am also available for individual sessions as well. Remember, if your child has Medicaid, this program is absolutely free. If not, an out-of-pocket option is also available to you as well. Please tell your child that Mrs. Bates said it's time to bring that explosive drama to the stage. I hope to see you and your child soon. Until then,